Greetings from the lands of the Lekwungen people here in Victoria, British Columbia. Thank you very much for inviting me to talk about some ways to think about the equity and health impacts of transportation planning decisions and ways that we can create healthier and more inclusive communities. So let's start off with an example of how transportation planning decisions affect our health. This is one of my favorite walks. This is my front porch. And we walk down my street and we turn a corner and we walk a couple more blocks. And some of you might recognize Vic High. And we walk through the field and we get to one of my favorite destinations, our local pub. So I'm a lucky guy because we have quite a few restaurants and pubs within convenient walking distance of our home. And so when I go out socializing, I don't have to drive, I can walk. Now, is it good that people can walk to their local pubs and restaurants? Is that healthy and inclusive? Absolutely. There are many benefits to us, the people that do walk, and to our communities if instead of driving, we're able to walk. For one thing, stepping back, you can see that our neighborhood is a low traffic speed, low traffic volume area. The streets are only 2 lanes wide. And if everybody going to our local businesses were to drive, you would have to widen these roads and create a more spread out and harder to and more automobile dependent community. You'd have to knock down many of the existing buildings to provide enough parking at those destinations. And families would have to spend a lot more on their vehicles. If you live in an automobile dependent area, you typically need 1 automobile per adult, and it's driven high annual kilometers. And so you're spending a lot more money and you're not getting as much exercise. So when I walk to my local pub, I can eat more. I can drink more. I'm burning off more calories, and I can afford that because I'm not spending as much money on my car. And I'm much less likely to cause a crash. I'm not driving home from the pub. And I'm creating less air pollution, and I'm requiring less pavement for roads and parking. And so we're imposing less water pollution or stormwater management costs and less heat island effect. A community is better. I would say it's a healthier and more inclusive community if we can ensure that anybody who wants can get around without having to drive. And that is really the theme of my presentation. So let's think about the many ways that transportation planning decisions affect our lives. So an average person spends more than an hour a day in out-of-home travel. So it affects our daily experience. And the average household spends somewhere between 15 and 25% of its budget on vehicles. It affects our economic opportunities, particularly if you're either have a physical disability and so you can't drive, or you're a low-income household, and so it's difficult to afford, depending on automobile travel. You're far better off economically. You have more opportunities to access jobs and education and affordable services if you live in a walkable community, in a compact, walkable, and transit-friendly community. Transportation planning decisions also affect our housing affordability. Every time cities impose parking minimums, so they put the cost of off-street parking into the cost of buildings, they're reducing housing affordability. The transportation patterns, how we travel, affect our health and safety. They affect our neighborhood, what you could call our public realm, the quality of interactions among neighbors. It affects our local economic activity, whether we have local jobs. It affects public expenses. So things like roadway costs and stormwater management costs can be reduced through less automobile dependent planning. And we're affecting external costs, things like the traffic congestion and accident risk and pollution that we impose on others. So transportation planning decisions really do affect us and our communities in many ways. So some of the decisions that this can include are things like how much money we spend on various forms of transportation. Are we spending money, or is our community investing in walking and bicycling and public transit as much as we invest in automobile travel? And what are the parking minimums in our zoning codes? And how are roads designed? Are they designed for maximizing automobile travel volumes and speeds, or are they what we call complete streets that are designed to ensure that people can get around without a car? What are the allowable densities, and therefore what types of housing can we build in the walkable urban neighborhoods? Do we allow the lower cost housing types like townhouses and apartments in the more attractive walkable urban neighborhoods? So, and where are we locating jobs and services? So is it possible to walk from your home to stores and restaurants and pharmacies and healthcare services, or do you need a car to get there? Those are all kinds of decisions that are going to affect our lives and our opportunities. For most of the last century, these decisions have primarily been oriented toward automobile transportation. And so we've created a self-reinforcing cycle of automobile dependency and sprawl. In recent years, transportation professionals and urban planners have recognized the importance of starting to reverse some of these factors and making sure that our communities are more multimodal, so you can get around by various forms of transportation, and more compact, so the distances that people have to travel are lower. Now, let's get into the first subject that we're going to explore, and that is transportation equity. And this is a complex subject. There are many equity factors to consider, or you could say perspectives. Some of them fall under what we call horizontal equity. It assumes that people who are similar, who have similar abilities and needs, should be treated similarly. So we could ask, are people who don't drive, people who rely on walking and bicycling and public transit, receiving a fair share of public resources? That's a horizontal equity question. And when somebody buys a car, they're basically expecting to have permission to add to the traffic problems. And so they're imposing more congestion and accident risk and air pollution on other people. Those are what we call external costs. And those, you could say, are an inequity, that it is unfair that people who drive less than average bear the congestion delay and the accident risk and the pollution damages imposed by people who drive more than average. So that's an inequity to consider in our planning. Then there's also what we call vertical equity, and that refers to the degree that we're considering impacts between people with different abilities and needs. So we could ask, are we making sure that our transportation planning ensures that people with disabilities and low incomes can get around and are not harmed? Are we addressing social injustices, historical policy, or historical structural factors that are inherently unfair, like racism and sexism? So those are the categories. The question is how to incorporate these into our planning process. They can be very complicated. It can be very complicated to account for all of those various perspectives. So it's usually best to identify what you could call transportation equity objectives, very clear, measurable goals or objectives and targets that we have for achieving our equity equity goals. Things like making sure that everybody receives a fair share of public resources, and that we serve non-drivers as well as drivers, and that we involve people who are affected by a transportation planning decision into the decision-making process. We also can say we want to favor the resource and affordable mode. So we want to make sure that walking and bicycling and public transit, which are more affordable and efficient, if anything, have priority over the less efficient forms of transportation, like single occupancy automobile travel. We can also ask, do our agencies and our policies support affirmative action to make sure that everybody has a chance to be involved, and that we're addressing past injustices. These are examples of objectives, measurable objectives that we can incorporate into our planning process. So let's look at a few of these equity impacts. For example, to what degree are various types of travelers receiving their fair share of the public investments, the money and road space devoted to different modes? So, you know, if you drive everywhere, you're only interested in automobile transportation, you could legitimately say, I want my share of public resources, invested in transportation infrastructure. I want them to go to roads and parking facilities. But if you rely at least sometimes on walking and bicycling and public transit, or you live in a household where other members of the household rely on walking and bicycling and public transit, you might legitimately say, I want to make sure that walking and bicycling and public transit, that those modes receive their fair share. So, and it turns out in most communities, somewhere between 20 and 40% of people either cannot drive or should not drive. They're dangerous, or they're straining their budget to afford a car, or they prefer not to drive, at least for a major portion of trips. So you could look at people with, you could consider, for example, people with disabilities, seniors, adolescents, people that maybe a parent who stays at home and shares a car and so wants to be able to get around, maybe pushing a stroller, or a wheel, or helping with a wheelchair around their neighborhood when they don't have a car available. Low-income households, people who temporarily don't have a vehicle because maybe it's in the shop, tourists and visitors, law-abiding drinkers, and people who enjoy walking and bicycling. Those are all, you could say, demands for non-auto travel. And in my research, I've explored the question, to what degree are we investing in walking and bicycling and public transit? And the results suggest that in a typical community, about 90% of the infrastructure dollars are being spent to accommodate driving, and only a very small amount is invested in walking and bicycling and public transit overall. You could say that to ensure that that non-drivers get their fair share, we should set targets for balancing that out. Similarly, you can also ask, to what degree, when do transportation, each transportation user impose external costs, infrastructure subsidies, accident risk, congestion delays, and air pollution on other people? And to what degree is it unfair to people who drive less than average that they're bearing these external costs? And again, my research suggests that when somebody gets a car, every time somebody gets a car, they are expecting governments to spend a lot of money on roads and businesses to provide off-street parking. And they basically are expecting to have a license to add, or permission to add, traffic congestion and accident risk and pollution on their communities. And this is unfair to people who drive less than average. So we can do that kind of analysis. Also, inclusivity, making sure that everybody can has opportunities to get around, requires that we consider affordability. To what degree are we ensuring that people with low incomes can get around and without bearing excessive financial burdens? Walking, bicycling, and public transit are far more cost effective. I can report from personal experience. Our family's been car-free for the last decade, that it is perfectly possible, if you live in a walkable urban neighborhood, it is perfectly possible to live car-free, and you can save thousands of dollars a year by doing so. Walking and bicycling in public transit, you can easily spend less than $1,000 a year on transportation. But as soon as you buy a car, it's hard to own a car and spend less than about $5,000 a year on your vehicle and the off-street parking that it requires. So there's a number of studies that have quantified this. One of them is done by our Capital Regional District, our local regional planners, and they identified the amount that households spend on housing and transportation combined in various neighborhoods. And what this shows is the people who live in the more compact central neighborhoods, the walkable urban neighborhoods, on average spend far less on transportation and housing than people who live in automobile dependent suburbs. And even if their housing costs are a little bit higher, that's generally offset, more than offset, than the much, much lower transportation costs in walkable urban neighborhoods. There's some good examples of really bad policies, unfair policies that have been implemented in the past. For example, in the past, transportation agencies often built urban highways, freeways, through very walkable and transit accessible neighborhoods. It was accepted that it was okay to destroy a neighborhood, one of the typically low-income, minority-dominant urban neighborhoods, in order to facilitate more commuting, automobile commuting, by suburban motorists. That was acceptable. And so there are countless examples, numerous examples of situations where we favored motorists, automobile travel, over accessibility, people's ability to get to jobs and services by other modes in cities. And this, you could, I think most experts now recognize this was terribly unfair and wasteful, and that we can do better, and that we need to correct for those errors. So let's summarize this. I know that was there's a lot of issues here to consider. So I develop this matrix that looks at how these various types of equity can be defined and measured, and ways to help achieve related equity goals. I'm not going to spend any time on this, but this information is available in documents that you'll see at the end of this report, end of this webinar. Let's look at the health impact. So transportation planning decisions affect our health in many ways. They affect our chance of dying in a car crash. As you'll see, people who live in less automobile dependent communities have a fraction of the traffic fatality rates as people who live in automobile dependent areas. So crash risk is a health impact. Another is the degree that people are engaged in physical activity. How many minutes of walking and bicycling do people engage in? And what are the planning decisions that affect that? Pollution exposure. So are we planning in ways that reduce the total amount of vehicle emissions and the amount that people are exposed to those emissions? What about affordability? Affordability is a health impact because high housing and transportation costs leave households with insufficient money to buy healthy food, afford healthcare services, and other healthy activities. And similarly, access to healthcare. So we can ask, to what degree do our transportation and land use planning decisions affect people's, especially people with disability or low income, their ability to access medical care, dental care, pharmacies, and other healthcare services. And so we could explore those. For example, a number of studies have looked at per capita traffic fatality rates. The number of people who die typically measured per million or 100,000 population. This graph compares the traffic fatality rates in what we call the smartest growth communities, the most walkable, compact communities, with the most sprawled communities. And what you find is consistently when we measure these kind of impacts, people who live in walkable, compact, multimodal neighborhoods have a fraction, let's say 75% lower traffic fatality rates as those who live in automobile dependent regions or areas. So traffic fatality is very important. How much people walk also varies depending a lot on their land use, on their community design. Walk score is an interesting indicator. It's great because it's available for most communities in developed countries. This graph shows Vancouver, or this heat map, we call it, shows Vancouver. Green indicates walkable neighborhoods. They have a walk score over 70. And that is basically the threshold for making sure that people can get around, get services and activities without driving. Similarly, there's a number of studies that measure people's access to jobs by public transportation. Can a person with disability or low income who can't afford a car or wants to avoid relying on driving, can they get to jobs? And we can plan partly by improving public transportation, but equally important is ensuring that there's plenty of affordable housing and suitable housing in the transit-rich neighborhoods, and that jobs and services are in those areas. So you can ensure that people who can't drive have access to lots of jobs and services. You can also look at emissions. We find that people who live in walkable urban neighborhoods tend to own far fewer cars and drive a lot less and spend a lot less money on transportation and produce far lower emissions per capita than people who live in automobile dependent areas. Some jurisdictions are starting to apply this information to achieve specific goals. For example, here in British Columbia, our province has targets to reduce pollution emissions, to achieve our emission reduction goals. So we have a number of strategies, some of which are focusing on changing the type of vehicle people drive. So things like going to hybrid and electric cars. But equally important, we have targets to reduce the total amount of driving and essentially double the amount of trips that are made by walking and bicycling and public transit, and creating communities where the distances are shorter. So that is you could say another reason or expanded reason for favoring the resource efficient modes over the resource intensive modes. We call this a sustainable transportation hierarchy. We say that transportation planning should favor walking and bicycling and public transit because those are affordable, inclusive, and they require less space and less energy and produce less pollution. So we could incorporate that into our planning. Last, I want to mention very briefly some of the lessons that we've learned from this little pandemic that we're leaving, hopefully. There was a lot of interest among transportation planners. What are and urban planners? What are the factors that affect contagion risk? The chance of people getting infected or dying from COVID. And what we found early on is there was a lot of suspicion that public transit was high risk. But the research actually showed, if you look at the map at the top, this happens to be New York, a map of New York, that the infection rates were actually much lower in the walkable and transit-oriented areas, things like Lower Manhattan and the inner boroughs, things like the closer in areas in Brooklyn, those actually had lower COVID infection rates than the more automobile-oriented areas. And the researchers, what we conclude is that walking or unenclosed travel, that is walking and bicycling and motorcycling, have the lowest contagion risk. Using public transit has a somewhat higher contagion risk, but so does driving if you're carrying passengers. And so the automobile-oriented areas actually had higher risk because most people in those areas are spending so much time driving, often with passengers. Another way to look at this is when the pandemic started. Initially, the big cities had the highest contagion rates and death rates, probably associated with the fact that they are major gateways. People travel from all over the world through their airports, and many people are either have family connections, they're immigrants, or they have business connections overseas. And so there was a lot, the big cities often had the first wave of infection, but over time, cities became relatively safer, and it was the rural areas, the small towns and rural areas that ended up having by far the highest fatality rates. And so we can conclude that people's behavior, their travel activity has much more effect on their contagion risk than just the density of their neighborhood, or even whether or not they use public transportation. We also learned a lot of lessons into how to accommodate pandemics or other major community stresses, major disasters. One of the things that we realized is that not only do pandemics create the pandemic risk or the contagion risk, but that we also need to pay attention to things like the ease with which people can live and work when mobility is constrained, when they're required to stay at home or stay in their neighborhoods, and how we can ask how we can support physical and mental health and reduce problems like social isolation during lockdowns. And we also discovered that many of the most critical types of workers, things like hospital workers or other service workers, don't have a car, or they rely on walking and bicycling and public transit. How can we ensure that low-wage service workers can get to work? So I would say that this is actually good news, that we're starting to apply more comprehensive analysis of equity and health impacts of transportation decision-making. In the past, we focused on pretty narrow set of solutions. We said that, if we are concerned about air pollution, we should change the type of vehicles and spend a lot of money subsidizing electric cars. And we can have targeted safety programs, and we can have targeted subsidies to help people with low incomes get around. And we can have targeted fitness programs. But with our greater knowledge of how transportation and land use planning decisions affect some of these impacts, we can now use more comprehensive solutions, what we could call structural solutions. So we're not just having special programs to encourage walking and bicycling, we're building walkable and bicycle neighborhoods. We're not just having special subsidies to help low-income people get around by driving or public transportation. We're favoring the cost-effective, resource-efficient, affordable modes. And we're ensuring that there's affordable housing in the walkable and transit-rich neighborhoods. We're not just changing the types of driving, the types of vehicles that people drive, but we're also helping people drive less. Those are the structural solutions. There's some good examples of these. The city of Vancouver has a fantastic, I think, what they call the Climate Emergency Action Plan. It includes many of these strategies for reducing the need to travel, creating more affordable housing and walkable urban neighborhoods. The devil is in the detail. The challenge is to get public support for the reforms, things like reducing parking requirements, allowing more affordable housing in the walkable urban neighborhoods, investing more in walking and bicycling and public transit in any community. So let me quickly go through the main conclusions of my research. Transportation, equity, and health are not single issues. They're an interrelated set of issues that often overlap and sometimes conflict. Transportation affects people in many ways, including some indirect and long-term impacts. So it's important that decision makers understand all of these impacts when making policy and planning decisions. These issues are challenging because there are many impacts and to consider, and many metrics and groups of people to consider in the analysis. The best approach is usually to develop some measurable equity objectives, and then you can focus attention. You can actually incorporate them into individual, we can insist that individual planning decisions support those strategic goals. Current planning practices often overlook or undervalue many of these equity and health impacts. So especially things like affordability, or are we creating communities that encourage active transportation? Are there unmet mobility needs for non-drivers, and how are we accounting for the impacts on vulnerable groups? Now, these to me are really exciting issues. These are opportunities. If you want job security, I can recommend that you become a local expert on the integration of equity and health impacts into transportation and community planning, because I can pretty much guarantee these problems will not go away, and there's going to be a lot of interest in practical ways to create healthier and more equitable and inclusive communities. So that is my presentation, a lot of information squeezed into a quick slideshow. For more information, visit our website, vtpi.org, and you'll find reports on all these subjects that go into much more detail.